Have you heard of Brene Brown's brand new book, Atlas of the Heart? This is a fantastic book about giving us a language around our emotions. And you're lucky enough that I went home and was able to have a conversation about the introduction and the first chapter where we're focused mainly on stress, overwhelm, and anxiety with my dad, who's a child psychiatrist. I hope you enjoy your sprinkle of wisdom. Well, thank you for being willing to talk about Brene Brown's new book, Atlas of the Heart. So Brene Brown is a researcher, very well known for shame research. But what this book is about is the fact that human beings are very much an emotional creature. That's how we live. We're not rational, we're emotional. Yet, we do not have a good vocabulary to talk about all the emotions we experience. Most people, if they are asked, what are the emotions? Name the emotions. People only list happy, mad, or sad. And that's the extent of what they can say. So what Brene Brown does in this book is actually allows us to have a better language when it comes to our emotions and states of being. So with you being a child psychiatrist, you have often said that this is a big problem that you see. So what is your experience with that?
I think we often see kids who really do only have the three emotions, happy, mad, sad, and they have a lot of difficulty expressing anything else. Anxiety is a particular emotion that kids have difficulty putting a handle on because we use the word anxiety to mean so many different things. Many people will use the word anxious, meaning eager. I'm anxious for this to happen. I'm eager for this to happen, as opposed to we think about anxiety being worry.
Right.
And so if you're not careful, you can ask a question and get a response simply because you have different definitions of the word that you're using. So it's very important to kind of establish a good language to start with, and that's why a lot of times I'll try to use two synonymous words to describe the same emotion so that the kid kind of understands. I'm talking about worry, I'm not talking about being excited, or I'm talking about being, instead of being depressed, I use the word sad and those kind of things. Sometimes the kids will even try to say, well, I'm sad but not depressed, and then you have to go, well, what's your definition of the difference between those two words? And a lot of times they do have good explanations for what they mean as the difference. In terms of intensity is how most people view that.
So when, especially with children, if they don't have a very strong vocabulary, how are they best to try to explain it? Or do they describe a story, or how do you see them try to express it?
Right, you get them to try to explain more about what the feeling is, and especially what brings it on and how they react to having that particular feeling, because we want to let people know that having the feeling is okay. Being mad is okay. It's what you do when you get mad that becomes the problem. So anytime we try to get people to describe the emotions that they're having, it's kind of, well, what happened that got you there? What's the things that happens in your body sensations when you have that feeling? And that helps kids try to identify, I'm getting mad early. I don't wait until I'm having the tantrum and blowing up. If I can take a step back and identify what my body does when I get angry, then I can take my time out and not let it get to the point that it's an explosion.
Oh, and that's really good. I guess you can even start with the behavior. It's like, why did you do that behavior, and trying to work back to the emotions, and then in the future they'll be able to identify that right before the behavior problem issues.
Right. I mean, our emotions are expressed through our body functions. So if we can get people to start to identify what does your body do that tells you you're having these emotions, sometimes that also helps people kind of determine what the emotion is and what they need to do in response to having that emotion.
Yeah, and Brene Brown talks about several different things that go into humans experiencing life emotionally. And I love this saying. She said, the human emotions and experiences are layers of biology, biography, behavior, and backstory. So the biology aspect is maybe what you're talking about, is even understanding how we show up in our bodies and why. And then biography, which is always fun, is how our families and our communities actually shape our beliefs about the connections between our feelings, thoughts, and behavior. Of course, then you have the behaviors that are go-to actions that are related. And then the backstory, which you just said, basically is what brought this on. So that was great. That's exactly what she talks about in the introduction. And I actually remember don't you have some cards with pictures of all the different emotions that you keep in your office? Would you hand them to the kids and say, find what you're feeling right now?
We do, especially the younger kids who have less emotional vocabulary. They get to go through the cards and pick the way that you're feeling, and then it's 25 different emotional cartoons, and then the child picks whichever one they feel represents the way they're feeling.
Very nice. And what age? I'm just curious, what kind of age range is that?
It's not necessarily age as much as how well they have an emotional language, but typically you're looking at the really young, below 9, 10. The elementary school age really likes it because I think to them it takes a step back. They don't have to necessarily own the behavior. The picture owns the behavior.
Yes.
So elementary school age or younger would be the ages that we typically use it with.
So what are some of the emotions that you feel maybe are the hardest to find words for that you see?
That's an interesting question. Just a second. I would think that the emotions that deal with being frustrated are the ones that are the most difficult for people to identify, because they go straight to being mad. When it's frustrated or even a sense of being out of control. Control is a big issue. If you feel like you don't have any control over what's going on, you're much more likely to react than the person who feels like they have some ability to control their environment and what's going on around them. So those kind of issues of hopelessness and frustration and feeling out of control are the most difficult for people to identify. People don't like to acknowledge that they're feeling out of control, and they will do anything in their power to try to insert control where they may. Sometimes they don't have any control over the situation, and other is they could have had more control had they not lost it at the point and driven everybody away.
Yeah, I mean, that's probably some of the initiating factors for a lot of issues. I think I've even heard eating disorders or other maybe acting out kind of behaviors is just from they want something that they feel like they can control, whether it's food or me throwing something. And so is that kind of what you see?
Exactly.
And kids, right? Kids don't have a lot of control.
Right, and that's one of the things we tell parents in trying to parent kids is the kid needs to feel like they have some areas that they have control in, so you need to pick your battles. It's not necessarily, you don't say, do you want to wear clothes or not, but do you want to wear the red one or the blue one? So the child still has some control over what's going on, and doesn't feel like everything is out of their control. And that's also about teaching children how to make decisions. So a lot of times parents will want to not let the child make any decision, and then they turn 13 and they go out in the world and the parents expect them to make good decisions, but they've never been taught how to make decisions all along. And some decisions we would think are stupid, but the child needs to experience the consequences of that. The child wants to wear something really goofy to school. And we go, okay, if that's what you want to wear, and then they go to school and the kids make fun of them and they learn, okay, this outfit doesn't work. I need to try something different. But that's a much more strong lesson for that child to learn than if I just said, no, you can't do it because I said so.
Yeah. And I think more than ever, we're in a time where a lot of people don't feel like they have a lot of control with COVID, political issues, all sorts of things, all globally even. So since you said that some of the things that are the most challenging to express are when we lack control, I think that actually fits very well with that chapter 1, where these are the emotions or states where we are feeling uncertain or it's too much, is what she says. So you've actually said some of these already. So the first, we'll just start with the first 4 of that chapter, is stress, overwhelm, anxiety, and worry. I feel myself wanting to say, and I hear a lot of other people say, I'm stressed and overwhelmed. Like, those are really common words I hear right now.
Right.
And so she said the difference would be stressed as being in the weeds, overwhelmed as being blown, is how she said it. And she gives a great example of when she was working at a diner. And they were kind of like code words that you would have, because this was a very, very busy diner. And so there was like a stress code word where it just means, I'm feeling a little stressed, can you help me out? And then there was a code word which meant I am overwhelmed, as in I need to completely remove myself and take a break. And they knew that as soon as you said that word, and I can't remember if it's being blown or what her code word was, it meant that they were taking over for you. You either went outside or you went to the cooler or whatever for your 5 minutes. You had a time limit, but it allowed you to step away.
Most of these are difference of intensity, and everybody has their own rating scale of where they feel stressed, where they feel overwhelmed. So most of the time we don't just use the word, but we identify the word and we talk about, okay, how is that affecting you or whatever, to help determine where the intensity is. A little stress is okay. If you don't have any stress, you're never pressured to do anything or to make advances or to make changes, but you don't want to be overwhelmed. And sometimes parents will come in and say, well, he does fine at school, but then he comes home and he loses it. And the comparison I give is, if I ask you to move my couch, you could do it. If I said, I want you to move my couch constantly up and down the stairs for no good reason, you can't do that, because you have to have breaks. That's too much. That's overwhelming. And so we have to identify each individual's level of where does stress turn into being overwhelmed. And most of the time it's when they just become dysfunctional, either interpersonally, as in they just get really irritable and angry and they're just making everybody else mad, or they just shut down and go off in the corner. And you try to get them before they get to that point so that they do have that chance. And I think parents also sometimes have difficulty understanding that kids do get overwhelmed, and we've misused the term timeout. We've taken timeout to mean a punishment. You go sit in the corner, and that's not really what timeout is. Timeout is a time for de-escalation. So the parent says, well, I don't want to send him to his room because he just goes and plays. Well, if that's what he needs to do to chill out, do that for 30 minutes, kind of de-escalate, then come back and take care of what you're trying to handle in the first place. Because we do want people to learn where their tolerance is and when they need to take a break. Now, sometimes kids want to use that as, I don't have to come back to deal with it. But just like the person who's working in the diner, they take their 10 minutes in the cooler, but they still have to come back to work. So the same thing with kids. They may need 10 minutes. You don't need to be in their face constantly. If they're getting really ramped up, give them the time to go cool off, but then they do have to come back and deal with things when everybody is settled. And parents sometimes need time out. We don't want to deal with our children when we are too angry. We often hear the story of the kid who goes, "Mommy, mommy, 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 mommy," and it's like, I just don't want to hear my name for 5 minutes, please.
And I think even in the workplace, sometimes they talk about putting in breaks throughout your day, which hopefully is to prevent you even getting close to being that overwhelmed state. But I think even I've noticed it in my work when you're a little bit snappier than you should have been, or that you need to find those signs and know that means I need to take a break. We've gone from stressed, overwhelmed, and then anxiety is something you were talking about early, and you may appreciate this. She describes anxiety as the Willy Wonka ride when they're going into the tunnel and all the bugs and the snakes, and she said that that's what makes her think of anxiety, is this confusing, scary even tunnel sometimes. Now, she also says that anxiety can be both a state and a trait as well. So I'll read out one of the definitions she had, and this one is actually from the American Psychological Association. Anxiety means the feelings of tension, worried thoughts, and physical changes like increased blood pressure. So again, we're back to that. It can manifest even physically, which hopefully we can take a note of and be able to address it. But she also talks about this could be escalating loss of control, worst case scenario thinking and imagery. I think that to me is more of back to the anxiety as a trait. You're a person that always thinks of the worst case scenario. And then again, we're back to this total uncertainty that might, I don't know, I would think of that more of a trigger of anxiety, but that again, that may also be if you're talking, I'm in an anxiety state versus it is a trait. So what do you think about that, and especially that the difference between it being a state and a trait?
I look at the first two, stress and overwhelmed, as levels of intensity, versus anxiety is a measure of duration. So stress tends to be more immediate, more short term, versus anxiety, which is a more persistent worry that bad things are going to happen. I'm not going to be able to deal with the future, or something bad is going to happen and I'm out of control of it. And some people are just constantly anxious, and other people tend to be anxious in certain situations, so it seems to pop up more frequently. And we do see both. A lot of people will come in and say, well, I'm having a panic attack. Well, what do you mean by that? And they describe physical symptoms. Well, what happened? Well, something went wrong and I was out of control and it triggered it. So yes, it's biologic, but it was triggered by something that was going on because you perceive that as something you can't handle, something that you think is going to go to become a disaster. And people who are more confident that they can handle these pop-up situations are less likely to get in that anxious state.
She said our anxiety often leads to two coping mechanisms, either worry or avoidance. Unfortunately, neither of these coping strategies is very effective. So I would like to think that there's another option then.
Well, and the other option that I would think of is fight, because we talk about fight or flight responses. And if you back an animal into a corner, even the most passive animal is going to come at you if he's backed into the corner. And I think we do that a lot of times with other people. We try to back them into corners to make them cower, but you back them too far and they're going to come at you. You still have to give enough space that that person doesn't feel threatened. And I think that's a lot of the reaction that the kids have in school. They feel like they're backed into a corner and have nowhere to go, and so it comes out as some kind of explosion.
Yeah. Again, a little bit of that lack of control, right? About being backed into a corner. Now, I guess, again, along with this, the theme of the book is if we can recognize the feelings of anxiety, we can assess, is this true? Is this helpful? Or I think it's something around there. Like, so there's might be some questions. Once we're seeing that we're showing these signs of anxieties, how can we kind of back ourselves down to fix the problem? Is it what do you teach, especially kids?
Along those lines, I think we look at past situations and then do what brought it on? What's the antecedent to it? What was your reaction? What was the feeling that you had that made you have that reaction? And then how did that work out for you? And what are other choices that you could make? And we talk about doing decision trees, and all of this can't be done necessarily at the time that everything's going haywire, but sort of afterwards and processing things. It's what are the things that you could have done, and what are the consequences of each of those things. The biggest issue I think kids have is they don't have a concept of consequences. All they're looking for is the immediate escape. And so if you practice ahead of time, these are some things you can do when this situation comes up again. Because most situations are not truly new. It's a different expression of that particular issue. But the other thing that I think parents can do is to be aware of what the kid is looking like and feed that back to them. You look like you're having a hard time hearing what I'm saying. You look like this is you're getting angry from this situation. You're looking scared. You're really irritable. Why are you irritable? And try to get the child to talk about, okay, I'm this way because I'm really irritable and angry now because being in crowds of people I don't know makes me nervous. Those kind of things. And then you talk about, okay, so what can you do when you are in this situation that can help you feel better? So it's kind of a constant teaching process, but the parent also has to be aware of the opportunity to teach and not just come at the child when it's a problem. They have to deal with it when everybody's calm, and let's talk about why things went the way they did, and you made these choices, and what happened when you made these choices, and what could you have done differently that would have made things turn out better.
Yeah, and again, one of the reasons that this is so important is not only being able to have a vocabulary to express emotions that helps us learn more about ourselves, but also to have better relationships, being able to connect better with people. And that could be a coworker, your significant other, but it can also be a kid as well, is being able to recognize some of those signs and be able to communicate that out.
Right. I think one of the things that's important along that line is kids need to feel like the parents are going to listen to them, that if they have an idea or they have a problem or they have an issue, the parents are going to help them deal with that issue, not get punished because of it. So there needs to have the establishment of a trusting relationship. Okay, I'm going to hear what you say. I may not like what you did. I may not like what you're thinking, but we're going to talk about it and me not berate you for it. We're going to help you figure out why I don't think that's a good idea and what may be other options, as opposed to just no, 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 no.
I hope you enjoyed this part of going over Brene Brown's book, Atlas of the Heart. On this channel, we talk about all the wisdom that we get from books that we read. So please hit subscribe, like the video, and stick around for even more. In part 2, we'll talk about the last chapter of the book, Pride, Narcissism, which everybody's talking about these days, and humility. So join us for part 2, but again, hit subscribe so you don't miss out. Until next time, this is your Sprinkle of Wisdom.